as you or one of your hospitals are eligible to participate in CMS's quality program. I'm Lynn Chase, and I'm joined by my colleague, Sarah Butterfield. Likely you've already heard from one of us or one of our colleagues. Our goal today is to review CMS's Quality Improvement Program and the no-cost support that's available to hospitals through the QIN-QIO. And then we'll turn the discussion over to providers that we have had the privilege of supporting over in the past. So next slide, please. We want to make sure that we're respectful of your time. We've got about 30 minutes. Sarah and I will start with a high-level overview of the CMS Quality Program. Then you'll hear directly from hospital leaders like yourselves about the experience working with the iPro QIN-QIO team. We'll close with next steps, including how you can confirm participation if desired. Next slide, please. So CMS delivers quality improvement support through 4 coordinated initiatives. For hospitals, the most relevant are the Quality Innovation Network, Quality Improvement Organization, or QIN-QIO, but also the beneficiary appeals, the Beneficiary and Family-Centered Care, or the BFCC QIN-QIO. Importantly, for the Mid-Atlantic, that contract is managed by Comments Health, which was formerly known as Levanta. And that is the QIN-QIO that is required to have an agreement with all hospitals. Next slide, please. So the QIN-QIO is a national program. It is divided up amongst 7 regions under what we call the 13th Statement of Work, or the work period from 2025 to 2030. iPro, our team, serves as the QIN-QIO for the Mid-Atlantic region, which includes Delaware, DC, Maryland, Virginia, West Virginia, and Pennsylvania. While our work is national, the support is regionally tailored and aligned with CMS's priorities and local needs. Next slide, please. So CMS has identified select hospitals, nursing homes, and outpatient practices and is encouraging them to participate in this 5-year initiative. Identification is based on opportunity, and it really reflects where CMS believes its investment of support can make the biggest impact. Participation is voluntary, but highly encouraged. And with that, next slide, please. I'm going to turn it over to my colleague, Sarah.
Thanks so much, Lynn. I'm just going to touch on the areas of focus that CMS has incorporated into this initiative. Not surprisingly, prevention and chronic disease management is one of the high priority areas. And within that pillar, you can see what falls under nutrition, physical activity promotion. You'll see diabetes, hypertension, chronic kidney disease, and behavioral health. Quality and patient safety is also one of the high-risk priority areas, and under that falls infection prevention and control, safety events, as well as adverse drug events, and hospital readmissions and utilization. Then transparency, interoperability, and care coordination, and that is looking at optimization of use of your electronic health records, also data sharing to coordinate patient care, and of course that crosswalks to care coordination, and also patient access to their records and care options. And then resiliency and high-performing healthcare systems. Under that pillar falls cybersecurity, emergency preparedness, supply chain management, process improvement, and facility accountability. These are the areas of focus that the QIN-QIOs, our organization, can work with you on to improve healthcare outcomes in the hospital setting. Some of the clinical areas of focus, just to drill down a little bit more, in optimizing patient safety, you can see the CLABSI, CAUTI, CDI, MRSA, and surgical site infections, the PSI 90 score, and adverse drug events. You can see everything that falls under that category. Also includes pressure injury and falls. And what's important about this initiative is that the measures also crosswalk to what you're publicly reporting now and what you're submitting already for those particular measures. Under the reduced readmissions and emergency department visits, overall improving communication and care coordination to minimize avoidable hospital utilization. And then under behavioral health care, equipping your team to manage pain management, screening of patients for depression, suicide risk, and substance use, and that follow through out to the community from the emergency department. And under preventative care, also in addition to those chronic disease management areas, increasing healthcare personnel influenza vaccination rates. Why participate? And you're going to hear some wonderful feedback from our hospital representatives. This particular initiative utilizes the QIN-QIO program, our project team of subject matter experts and quality improvement specialists, to work with you to augment your quality goals and to meet you where you are with those particular areas of priority. Also, it helps reduce penalties related to any of the CMS quality reporting programs. We are able to provide an aligned approach to you and tailored technical assistance in individualized support and collaboration. Also to support your and address any of the data needs, showcasing your organization's successes, and improving those quality outcomes and avoiding harms. And certainly collaborative learning best practices. We are across many, many states and have the opportunity to connect you with your peers and also to problem solve on some of the challenges you may be experiencing for those particular measures. All of our work is data driven. We have Medicare fee-for-service claims data that CMS provides to us. We're also supposed to be, we are also expecting Medicare Advantage data to be able to provide drill down to what we're seeing in each of those quality measures for you. And the key benefit to this is the ability to provide you actionable data, current data, and in the past, this is a snapshot of one of the quarterly Medicare fee-for-service care transition reports. This is just one page of a 21-page report that provides drill down benchmarks and the ability to see where your ED visits, readmissions, admissions are coming from in the community. This particular initiative is very important. CMS is encouraging providers to participate. What you have within this slide, which we will be providing to you, is a link to the annual Medicare participation letter that came from CMS, and it identifies what is included into their Quality Initiative 2026. It also highlights the QIN-QIO participation in the program. And there's also a second link to Tracy Archibald, who is the acting director for CMS in the Quality Improvement Innovation Program, again highlighting the Quality Improvement Program, more detail on what the QIN-QIO is and the benefits that you'll receive from participation in this free program. It's provided free of charge to your organization as it is funded by Medicare. And if the program, as you heard Lynn describe, it is voluntary. CMS has identified the providers for us to reach out to and enroll in the program. We do need to identify the providers that have joining in the program and that have enrolled. And you also have the opportunity, if you opt out of participation, we will need to include that decision, who made that decision and why, to the Centers for Medicare and Medicaid Services. Now I'm going to turn you back to Lynn for the exciting part of the program.
Oh, almost the exciting part of the program. You've heard a lot from us, and probably a lot from us over the last couple of months. But I'm excited to actually introduce you to providers who have worked with us in the past, so you get a better sense of how our teams work and what it might look like for you. So with that, I'm excited to introduce our panelists, and then I'll turn it over to them, which really is, as Sarah said, the more exciting part of this program. Sarah, can you go to the next slide? So first, I'd like to introduce you to Angela Dubach. Angela is Director of Quality Services at Central Maine Healthcare, where she leads initiatives to advance quality and patient safety. Her work emphasizes evidence-based practices, continuous performance improvement, high reliability, and collaborative problem solving. Central Maine Healthcare is an integrated healthcare delivery system that serves approximately 400,000 people across central, western, and mid-coast Maine. Central Maine Health includes Central Maine Medical Center, an acute care hospital, along with two critical access hospitals, Bridgeton and Rumford. The healthcare system also includes Central Maine Medical Group, a comprehensive primary and specialty practice organization. And we'll hear from Angela in just a little bit. Next slide, please. And I'd like to introduce you to Nina Lang. Nina is Director of Case Management and Behavioral Health at South County Health in Rhode Island. She's, and I know personally, she's a champion for care transitions and other efforts to reduce unnecessary hospital readmissions. South County Health in Rhode Island serves a population about of 100,000 residents in the southern part of the state. The health system includes the acute care hospital, the home health services, as well as physician office. And you'll hear from Nina in just a minute, and we're going to go to the next slide. And I'd like to introduce you to Karen Doyle. Karen is Director of Quality at Berkshire Health Systems. And Karen, I'm very excited that she's here and that the Joint Commission didn't show up today. Karen leads system-wide quality and patient safety initiatives with over 20 years of healthcare management experiences. She advances evidence-based practices, performance improvement, and regulatory compliance through collaborative and data-driven approach. Berkshire Health System is a 3-hospital healthcare system serving about 125,000 residents across Berkshire County in Massachusetts. The system includes Berkshire Medical Center, Fairview Hospital, and North Adams Regional Hospital. And again, we'll hear from Karen in just a minute, but first I'd like to introduce you to our final panelist. Next slide, Laura Sims. Laura is Senior Director of Quality and Risk and Corporate Compliance at Haywood Healthcare. She's a registered nurse with a clinical background in adult critical care. She's led quality, risk, and compliance efforts since 2022, advancing patient safety and regulatory excellence through a community focus. Haywood Healthcare is an independent, nonprofit community healthcare system serving north central Massachusetts and southern New Hampshire. About 65,000 residents are supported by the system. The system includes Haywood Hospital, a 134-bed acute bed hospital in Gardner, Massachusetts, Athol Hospital, a critical access hospital in Athol, and Haywood Medical Group, with primary and specialty practices across the region. Next slide, please, Sarah. So now is the fun part, the part that we think will be most valuable for those that are on the phone. We're going to invite our panelists to talk about their experience working with us in the past. Each panelist will ask what are the insights or recommendation you would have for those providers that are on the phone from the Mid-Atlantic. And I would also invite those of you on the call, if you have additional questions you'd like to explore, please feel free to put them in chat. If we have time, we will certainly take a minute to open those up. But now can I invite Nina? Nina, can you talk a little bit about how we've worked together in the past, what that looked like, and what you'd recommend?
Sure, Lynn, thank you for having me, and good afternoon to everyone. I would like to say that my first introduction to the QIO was actually back in 2011. And it started at that point with one physician from South County Hospital who also oversaw some skilled nursing facilities and a home care agency as well. And he noticed that patients were continuing to bounce back and get readmitted from his facilities to the hospital, and he really wanted to work on a way to streamline transitions of care. So what started with one PCP at the time, we developed a group of traditional and non-traditional providers, which we at that time called the Washington County Coalition. We had a total of 2 hospitals. We had hospice agencies, we had home care, assisted living, and skilled nursing facilities. And we would come together with the support of the QIO and develop strategies to work on transitions of care. And what I can say was truly beneficial was our readmission rate. We actually decreased our readmission rate with the help of the QIO and the coalition by 20%, which is huge because we were seeing a lot of chronic disease readmissions. And some of the strategies that we implemented with the help of the QIO was the improvement of transfer of communication. We worked on nurse-to-nurse report. At the time, there was no organized communication from skilled facilities and or the hospital or assisted nursing facilities. We developed a MedRec program where we actually had a pharmacist that was employed at our hospital, as well as going to the skilled nursing facilities to help with med reconciliation. And at the time, we had a 96% accuracy rate of medication management when transferring patients from a hospital to a skilled nursing facility. We worked on what's called Walk a Day in My Shoes, which was a shadowing program where I actually participated in that. I went to one of the skilled nursing facilities and shadowed a nurse for the day to really understand what it was like, because I forgot so many years ago. We developed a nursing home capabilities guide, which was a statewide guide, and we would have a better understanding of what the facilities and what they are capable of managing, and just a better understanding of their transitions of care. We developed brown bag medications. We worked with pharmacists and primary care doctors to ensure that patients had all of their medications before discharge. The families would actually bring in the medications from home, and the nursing homes would go through the medications and ensure that all of their medications were reconciled by the pharmacist. I could go on. I know I only have a couple minutes, but without the help of the QIO, with their best practices, with their Medicare fee-for-service claims data, root cause analysis support, they helped us with multiple interventions, many I just mentioned, measurement strategies, consultations. They have been instrumental for those meetings for the coalition. They would prepare our agenda, they would write the meeting minutes, sending notification, they would display the data, and we were able to understand it in a way than just showing it on a screen, which was really beneficial. We also had learning opportunities that were set up with the QIO that we would be able to have real-time question and answer specific times where we would be able to they would be able to assist us with improving our transitions of care. I would recommend the assistance of the QIO to anyone who has any doubts, any questions. It's free, and I can't say enough about it. So thank you.
Thanks so much, Nina. And as you were talking about it was a while ago, 15 years ago, I was thinking about Dr. Bandolini and
Yes.
the shadowing. I had totally forgot about that.
Yep.
Thank you. Thanks so much. And again, if folks have questions, feel free to put those in chat. I'm wondering if I can invite Karen, if you wouldn't mind jumping in and sharing your experience working with our
Sure. I don't mind. Over the years, I've had several experiences, but in the last 3 years is when I've really worked hand in hand with the iPro. I can speak personally as a quality director of the 3 hospital system that, you know, the focus of what they can offer and help provide and support is priceless, really, because there's so many things that change in the quality realm landscape, which might not be totally visible to senior leaders. So I would suggest go to talk to your quality people and say, would you possibly benefit from this? Because a lot of the work we do, you know, gets represented through up the chain of commands, but you know, the day-to-day stuff and having to dig down in and do deep dives and understand things really comes from a collaboratory agreement with these fine individuals. And the thing is, it's about sharing best practices. You know, you talk about patient safety, about readmissions, about health equity, social determinants of health. And I can't speak highly enough on the help and assistance that they've helped provide with our 5-star rating, because as critical access hospitals, we voluntarily report. So then it's like kind of like a game, like, oh, should we report this? You know, you have to have this many measures in this group and you need your 5 domains, and, you know, to totally drill it down and break it down and help leadership also understand what the implications are if you do voluntary report and which metrics should help you be beneficial for your team and your organization. The other thing is, like, when you're on these collaborative groups, you have IT support. You can find out, like, oh, we got 5 other hospitals on here. Who has Meditech? Who has Cerner? Who uses Epic? What did you do for sepsis? What do your interventions look like? Oh, how did you fix that problem? So it's like bringing practices to light for everybody so that we can all learn and bring it back to our team and be successful. I mean, that's huge. In Massachusetts, we had to get our health equity joint commission certification. We worked for a long time with the HQIC in regards to that. And, you know, we came up with best practices and, you know, we had a successful joint commission health equity survey. So it's not just about health equity, it's about social determinants of health and finding resources to support those people with certain needs. So that was super helpful. The other thing they have the best tools and tips for patient safety. They have a whole falls program. They offer additional insight. And yeah, benchmarking. So for critical access hospitals and rural hospitals, it's sometimes very difficult to come up with benchmarking guidelines. So no better place than to ask, and then they provide us. So, I mean, it's great because sometimes we don't have the resources that a lot of larger institutions do. So being rural or critical access, it gives a special attention to those areas that really need focus on. Personally, they've added to me in my professional growth and development as a quality person. And I would highly suggest you ask your team if they're interested.
Thanks so much.
That's what I have to say. So feel free to ask me questions at the end.
Thanks so much, Karen. We appreciate you guys being here. And I just would acknowledge that everyone is here voluntarily, and they were quick to agree to share their experience, and so we are grateful. I'm wondering if I can invite Laura. Would you mind sharing your experience?
Sure, Lynn. Excuse me. So I came to Massachusetts almost 4 years ago, and when I first came up here to work with my organization, in my experience in Texas, we didn't have this relationship with our QIN-QIO. So I was very, very skeptical about participating or sharing anything because you know they work with CMS and they can be the big bad dogs and they can penalize you and you can get into trouble if you're not doing well from different quality standpoints. So it took me a little bit to feel comfortable with a group. But what I've learned over this past few years as a small independent community system without a lot of financial resources, what it has afforded us is really that these folks in many ways have become an extension of our team. We don't have the money to affiliate with the PSO. So when I need national benchmark data, I go hunting on the internet for it because I can't reach out to my PSO and I don't have other bigger colleagues within my own organization that have that data. So at our critical access hospital a few years ago, we were really struggling with our patient safety events, and we had a lot of falls with fractures in our system. And I couldn't find benchmark data for the various levels of care that our facilities have. I searched everywhere. I wasted hours and hours, but I really needed the correct data to share with my team to demonstrate how out of whack we were with our falls program. So through the affiliation and collaboration with the QIO, QIN, and my colleagues that are on these regular calls, I was able to get national rates, fall rates per 1,000 patient encounters, which I could not get any other way or through my state hospital association. When we wanted to really implement a more robust falls program, I didn't have money to afford bringing experts to my organization. So the QIN-QIO helped identify experts for us. And they were willing to do webinars with some really jazzy people who makes so much more sense to others within the organization because it's not Laura, the quality leader, squawking at you, telling you what to do. This person, Pat Quigley, she's like a national falls guru. She's very excited and she has a wonderful way of communicating, but without the QIN and QIO, I would have had no idea about this person nor the webinars or programs she provides. And as a result, it came across much better to my own leaders and staff at our hospitals than I could have in any way. In terms of, as Karen mentioned, we've all been working on health equity. Again, we don't have a lot of money as a nonprofit independent hospital. And so when I needed to find some patient education materials for members of our community that did not speak English, I reached out to the QIN and QIO, and I was afforded some really wonderful patient education materials on hypertension and stroke in other languages, which I couldn't have produced or afforded to have translated within my own system. And I could go on and on about the things. The other thing is really that it created and afforded me an opportunity to network with my peers around the state. Karen and I have sat on many calls together, and she's on one end of the state, I'm on the other end of the state. And without this networking ability and the folks that I've been working with over the past few years, I wouldn't have someone to go to or ask a question about because I don't use the most frequently used EMR. I've got a Meditech EMR, and I have found others within my region that utilize the same systems than I do, and I can now call on them independently because we know each other and have developed a relationship. So while I was very skeptical at first, I can tell you they are not tattletales to CMS about what you're sharing with them. Anything and everything is on the table. And if they don't have the answers or the resources at hand, they go to great lengths to make sure they find resources for us. So I'm very grateful that I'm in this region have had the opportunity to work with our QIN and QIO over time. And I'm sorry we lost them to your region. Thank you.
Thanks so much, Laura. I think that's so true. It's not what we know, it's who we know, and we're very fortunate to know other providers who've done something, and that's a value that we can bring. And you all are amongst that. Angela, can I invite you to share your experience?
Absolutely. Thank you, Lynn. I'll keep it really short because the good news is everything that you have heard from all three of these ladies has been the exact same experience that I have had as well. And so I don't want to repeat things that they've said, but I can just assure you that, you know, we're all short on work. I mean, on time to do our work. I'm sorry, I'm getting a call. On time to do our work. And, you know, we all probably worry that this is going to be a burden, and it was quite the opposite. You can use it as you need it for what you are working on. And we needed help similar to you all with a VTE problem we were having. And we, like you all, have limited resources and finances. So we are on Cerner, and Gloria went to bat to find us another hospital on Cerner, and we were able to collaborate with them and to implement a risk assessment to standardize that whole process in our hospital. That would have cost us a lot of money if we would have went for an IT solution. So I can't say enough good about our collaboration as well. It's been fantastic, and would encourage you all to join on.
Great. Thank you all. And again, I thank you for taking time out to share your experience. If folks have additional questions, feel free to reach out. We're happy to put folks in touch. Sarah, can we go to the next slide? So we have talked about the program, what the focus areas are. Today you got to hear from other providers about how we work with providers, doing our best to sort of meet your needs where you're at. If you're interested and ready to join, we would love to be able to support your teams. Following this session, we're going to send you a service agreement. To join, all you have to do is simply reply to that message, which will serve as a confirmation that you want to join. We'll get you started, and then once you enroll, you have access to all of our assistance, our resources, and education, including our current offerings right now, where you heard Angela mention Gloria, one of our quality improvement managers. She's actually providing coaching through a 9-week Quality 101 training. Great opportunity to get new quality staff, but also other staff members on board with quality and prep for new initiatives. We're also just started, actually earlier this week, hospital topics on infection prevention. It seems like it's a really has garnered interest. There was over 100 registrants for the first session. Our infection preventionists will walk through topics and great peer-to-peer sharing opportunity. Next slide, please. Do you still have questions? I want to thank the provider panelists who were willing to share. They have put their own emails in, so feel free to reach out to them directly. If you have questions about the program or what we might be able to do for you, feel free to reach out either to your local point of contact who you may have already spoken to, or Sarah or myself. Our information is here, and we'll include these slides when we send out the agreement later today. I want to thank you for your time and attention. I know we went a little bit over, but I think it's really important that you hear from others that we've worked with, that what we say we're going to do, we actually do. And we'd love the opportunity to support you in your quality needs. Thanks, everyone. Feel free to reach out, and I hope you all have a good rest of day.